Good morning, everyone. Yeah. So I'm Madam Sim. I think semua tahu saya lah kan. Alright. So today we will start for this training course, postnatal care training programs. Alright. So before we start, let's do some ice breaking. You know me, but I don't know you. Right. So tell me a little bit about yourself. Okay. Come, tell me about yourself. Right. And also, how long you have been working in confinement center? Not necessarily in Kai, but maybe start from after you out from school, and how long you have been in this field. Okay, and also, what is your expectation that you want to learn today in these 2 hours? All right. So something very simple. Just let me know about you. Okay, can we start from that side? Yeah. No need to stand up. You just share a little bit about you. What's your name? Yeah. Siapa nama?
Saya Maureen.
Okay, Maureen. Ada anak?
Saya ada 2 anak.
Okay.
Married juga.
Alright.
Lepas tu,
This one.
how long have you working in confinement center? Almost 2 years lah.
Okay, very good. Okay. And this one?
Purpose learning.
Oh, what you expect to learn today?
Pengalaman lah.
Okay, can accepted. Right, come next, mommy. Thank you, Maureen. What's your name?
Nama saya Yansa.
Okay.
Saya bekerja di confinement selain kait almost 3 years lah.
Almost 3 years. Okay.
Hari ini ada tambah pengalaman lah.
Okay, tambah pengalaman. Okay, very good. Thank you very much.
For a year.
Okay.
I have no background in it lah.
All right, never mind. Good.
The purpose of learning to know discover more about psychological reproduction.
Okay, Ken, thank you very much.
I have 4 children, single mother, working in confinement center 1.5 years before this environment, now 1.5 years.
All right, so about 3 years, Okay, good.
Purpose of learning, reflect that, and gain more knowledge.
Okay, get more knowledge. Thank you very much.
Hello, I'm Nomi. I'm almost 1 year here. Almost lah.
All right.
Purpose to gain knowledge.
Okay, good. Thank you very much.
I'm Heidi, and I've been working in the conservatory for 1 year.
Hmm.
And the purpose of learning today is to gain more knowledge so I can answer Mommy's question later.
Good. Yeah, hope can really help you. Right, very good. Thank you.
Saya ada 6 orang anak.
Oh, very expert already, Okay.
Sudah mati juga lah.
Okay.
Saya dalam confinement baru hampir setahun juga lah.
Okay.
Ada kain-kain baru 4 bulan.
All right. All right. Good.
Nak cari pengalamannya
Okay.
tidak. Tapi nak kalau tidak boleh banyak lagi pak. Nak cari untuk ilmu.
Okay. Very good. Yeah. So the person. Okay, our next mommy. Okay. Okay. Very good. All right. Thank you very much.
Kalau mana you have been working for 9 months, saya dalam Sudah kerja aku.
So about 4 years, okay, very good.
So fokus learning tu ada yang baru dapat bantu mami-mami sini lah.
Okay, very good. Thank you very much.
Saya pasti bakal mak kedua anak.
Okay, very good.
Sebelum ni di blessing 1 tahun ada. Untuk learning nambah ilmu.
Okay, very good. Okay. Okay. All right, very good. Mm-hmm. Okay, this is a new one. Before that, ada kerja tempat lain, confinement center, nursing home. So it's totally different one, huh? Okay, very good. Okay, gain knowledge, right?
Hello, saya Salisa. Saya kerja dekat sini almost 1 year.
Alright.
Saya apa Kak Nomi? Tambah ilmu.
Okay, tambah ilmu. Okay, very good. Thank you, everyone. So I think that is why we have this course today. Tambah ilmu. I think confinement center serve a purpose to make sure everyone know how to work well in confinement center because you are actually nursing not only baby but also mother, right? Yeah. So today we will learn this. Okay. So about me myself, yeah, Madam Sim. Saya ada 3 anak. Okay. And then in nursing life, I think more than 20 years already. Right? In between these 20 years, I work in a hospital, work in a university, and work in confinement center. And now we open a own lactation center, Love Lab. Right? So that's why I'm here today as a nurse, as a midwife, as a lecturer, as a lactation consultant to guide you this course. Alright, so our objective for today, so that you'll be able to identify common postnatal issue, support maternal recovery, offer nutritional guidance, conduct postnatal assessment, and also provide proficient breastfeeding support. And our learning outcome after the training, then you will gain comprehensive postnatal care knowledge and skill to provide effective postnatal care and supports to new mothers and to be prepared to work at confinement care center. So this one, hopefully it will upgrade your level in your skill working in confinement center. Alright, so we'll go to module 1. You have all the workbook, right? Okay, so module 1, first lesson that we want to learn today is normal physiological changes in the postnatal periods. We all know mother got a lot of problems, right? Okay, so during postnatal, selalunya you have encountered mothers, right? Regardless of you are housekeeping or you are admin, marketing, or you are nurse in nursery, right? We all know that when mother comes in, after beranak, they usually encounter some problems. So what is the problems? Usually that you've seen before. This group come. Problem? Breast engorge, okay. Wound pain, okay. Selalunya emosi, selalu mau marah orang. Okay, what else? Depressed. Nangis. Okay, what else? Any other? Worry of how to take care of baby. Yes, especially first time mom. Any other answers? Don't know how to breastfeed. That's why Madam Sin selalu sini. Yeah, what else? You encounter anything? Complain about the food. Ini tidak panas. Tak cukup panas. Saya mau panas-panas punya. Enggak nak. Yeah, maybe lah. Yeah, bad temper, yeah, emosi, alright. Yes, they actually got a lot of discomfort. Now today I'll bring you in here, then we understand mothers better, right? Then we will know how to nurse or how to communicate with them better. Most of you here are mothers, yeah, most of you. That day I think we have mostly are single. Today one we have mostly are mothers before. Yeah, you have give birth before, so I think you understand mother before. But sudah lupa mungkin lah. Right? So today I recall back for you. Right? So the postnatal period, we also call it puerperium. Right? It beginning start after baby beranak. Dia sudah dilahir lah. Right? And last 6 to 8 weeks. Means that during confinement, we call it postnatal care, right? They stay here for how long? Berapa lama? 28 or 40 days, right? Yeah. You will see 42 days is about 6 weeks. That is usually in theory, we call it confinement. And this postnatal period, there is a lot of changes. Changes into what? Transform into transformer kah? Tidak. Masa beranak, masa pregnant, sini lemak, sana lemak, right? And all the system upside down. And it takes 6 weeks go back to normal. Bukan 2 minggu, bukan 1 minggu. Even the perut besar, it also take times back to normal, right? Yeah. So it takes how long? Yes, it takes about 6 to 8 weeks, or we make it 6 weeks, yeah? So during this time, mother's body actually undergoes various physiological changes as it recovers from pregnancy and childbirth and return to the pre-pregnancy state. Ini perlu ambil masa, bukan hari ini saya beranak, besok saya slim down already. Ever got mommy worried by 1 week later on, dia tanya, kenapa perut saya masih besar? You see that mother so slim already. Ada kah? Start risau. And then, lepas tu dia cakap to the auntie, kasih saya setengah nasi cukup, saya tak mau makan banyak. Because I'm still fat. They worried. So, what is the advice to mother? 1 minggu dapat kah back to normal so fast? Cannot. It takes how long? 6 to 8 weeks. Right. So, how are you going to tell mothers? Sabar dulu, mami sabar. Like that kah? Oh, we cannot use sabar. Oh, sabar, sabar. Lagi sabar, lagi dia geram. The words that we have to use is, don't worry, mother. What you want to explain to her? Tell her the real fact. Can get 1 week back to normal? No, it takes how long? 6 to 8 weeks. Even when mother is crying, later we'll talk about emotional. It takes how long for mothers to get back to normal, right? So, about 6 weeks, okay? And, right, sorry. And firstly, lepas mother beranak, usually they will feel cramping. Cramping dekat mana? Kaki ya? Where? Perut. The perut after baby out, and mother can still feel like, kenapa masih sakit? Especially when they breastfeed, right? Once breastfeed, memang sakit. Kenapa? Because breastfeed and it can cause contraction because release of hormone oxytocin. Yeah. Then this oxytocin will enhance the contraction. Kasi kejut cepat sikit the rahim back to normal. Do you know how big is your rahim before beranak? At the moment, now inside you, how big is your rahim? Berapa besar? Can you point to me? Just pakai your tangan, this big, this big, this big. Come, show me your hand. How big is your uterus? It's okay because you never learned before and it's okay. You just teka. How big is your uterus? This one, okay. Who else want to teka? This one, okay. How big is your uterus? The rahim, bukan ovary. Berapa besar your uterus? Uterus, what is the shape? It's like a triangle shape, right? So ini uterus berapa besar? Yeah, no matter what you point, it's within your hand. I don't see anyone point like that, right? Yes, that is correct. It's about 7.5 cm. Very tiny uterus. But masa pregnant, berapa besar the uterus can goes up to? Wah, betul-betul boleh simpan satu big baby. Not only one, can simpan dua baby lagi, kan? So you can imagine this big uterus after baby is out from the uterus, and this rahim jadi macam mana? Lembek, kan? It's like a balloon. After keluar the baby, then it become kecut. So kecut, within one day, kecut back to this size? Will it back to this size immediately? Lepas beranak? Tidak. It takes how long? 6 weeks. Yes. So during this 6 weeks, you will see this uterus begitu besar. And it needs to be contract slowly back to normal size. So how it will contract back? It needs hormone oxytocin. Jadi itu oxytocin dari mana? While you are breastfeeding, and mother can feel it strongly contract. So breastfeeding helps for the healing. Right? That's why we always encourage mother breastfeeding. It's not only for baby, but for mother herself. It can help to kecut balik the rahim lebih cepat. Some within 2 weeks, mother don't feel the pain already. Yeah, because of breastfeeding, then it heal faster. Okay, so mother will feel cramping. And masih ingat that cramping? Those who pernah beranak ataupun lupa already. Lupa sudah. Some don't even really feel it. Yeah. Some you just feel a bit discomfort. Tapi for you, you can tahan. But have you ever seen mother complain perut sakit sampai sangat sakit and need painkiller? Not the cesarean pain, it's the uterus contraction pain. Pernah? Pernah kan? Some mother will complain pain. So it's very discomfort. And we call it bleeding. But actually that is not bleeding. What is that? We call it lochia, right? We call it lochia. Or that is because the uterus contract. Yeah, I will show you the words. When the uterus contract, jadi inside there's some blood, some residual yang tidak perlu akan keluar dari badan, ya, dari rahim. So we call it something like periods, right? Postnatal kan dia ada berdarah lagi, dia perlu pakai pad, right? Right? So we call that lochia. And mother can feel the tummy is very tender. So mother sometimes hairan because first time mom, kenapa perut saya masih keras-keras oh? Is that keras good or bad? Should feel lembek or should feel keras? Lembek. It should feel tenderness. So when mother lie down, once come in, if you palpate the tummy and the tummy feel very hard, sangat keras di sini. That is good. It means the uterus is still contracting. Kalau dia lembek, you touch, sangat lembek, and the bleeding is heavily flow. Then you know the uterus is not contract and dia pandai berdarah banyak. So when mother asks you kenapa contract, your reassurance is, ini bagus. Ada contract itu bagus. Jadi you punya rahim boleh kecut to the smaller size. So when you touch tummy after deliver, especially the first 2 weeks, when you feel the tummy is hard, is that normal? Baru saya cakap. Tender, normal. So you perlu ingat because these are the questions that mother may ask you. Right? So, you have attended this class. And Madam Sim said, yes, lepas beranak, perut rasa tender. That is normal. Kalau sangat sakit, for some mother it's very painful, for some mother it's not. And the tenderness, dia bukan selalu. It is also come with a few minutes then go off. A few minutes and go off. Or it is worse when mother is breastfeeding. Because it can cause more contraction. Right? Jadi, ada tenderness after beranak, normal or not normal? Normal. You have to be confident that it's normal. Kalau lembek, berdarah banyak, is that normal? Not normal. Our action is immediately sent to hospital. Right? Jangan tunggu sana lagi. Tunggu sekejap, kita cek lagi. Yeah. So, it is good if the perut is tender. Now, this is what we call the discharge. Right? Lokia. Lokia is a medical term, or we call it the periods after beranak. Masih ada berdarah kan? Ya, berapa pad you tukar? Ada you monitor the pad? Ya, perlu monitor kan? Tapi tak tahu kenapa nak monitor. Just monitor sajalah. Tulis saja, nanti doktor sendiri tengok. Right? Today I'll tell you why we want to monitor the blood loss. Right? Every day we ask mother to change pad kan? Kita nak check. And usually the blood loss is getting more or getting less. Yes, it's getting less, right? So this blood loss, we call it lochia. It is a vaginal discharge after childbirth and consisting of blood, mucus, and some uterine tissue. Until bila habis for this blood loss, sampai the uterus back to normal size. So usually when you do the pad chart, sampai bila mother tell you only stand sahaja, nothing already. Usually bukan masa dia mau balik kan? Usually after 2 weeks, dia sudah kasih tahu kamu, this one already no more. I just use this one mini pad only, panty liner sahaja. Usually about 2 weeks. But for those mother who is not breastfeeding, it may last 3 weeks or 4 weeks. They're still using the normal pad, right? So mother who is breastfeeding, then the blood loss and the uterus will contract back normal, and the blood loss will reduce. So mother actually more healthy. Right? Kalau satu mami selalu berdarah banyak, that's why you have to feed mother with the red dead drinks to replace back the ions for the blood. So if you can help mothers to breastfeed more, mother less blood loss, they heal faster. Right? Ini boleh faham? Okay. Now this lochia, of course, we divide into 3 stages. First stages, we call it lochia rubra. Now, this is just for your knowledge. Lochia rubra is a bright red, heavy flow, and it lasting for 3 to 4 days. Means that the first few days, blood loss, it is actually very fresh red color. Yeah, just like our first day periods. Dia sangat banyak dan very fresh color. When it comes to about second week, 4 to 10 days, we call it lochia serosa. It is more to pinkish brownish. The color looks more dark color, right? And it lasts 4 to 10 days. Akhirnya, lochia alba. This one is more on yellowish white discharge. Means it's habis sudah, almost finishing, right? Then it lasts about 6 weeks. So this one, it really depends on mother. If mother breastfeed more, it will not last for 6 weeks. It will only last maybe just 2 weeks. So when you check pad, mother will say, oh, saya tak ada tukar sudah. It's just a panty liner, right? It's just a little bit normal discharge, right? So that is normal. So this is what we call normal lochia. But if mother comes in, therefore, supposed to be pinkish brownish, tapi mother tell you, saya 2 jam tukar sekali. And it's a lot. So what happened to this mother? Something is not right, right? Yeah, we shouldn't have seen mother bleed a lot when they come to confinement center. And the amount should be every day getting less. Tapi bukan hari ini tak ada, besok banyak. No, it is abnormal already. So when you do pad chart for mothers, yesterday, a day before, semua normal, half quarter pad change, half quarter pad change. Then today when you come on shift, mother tell you, I full pad sok. Mungkin saya makan kacama lah. Sometimes they will tell you, I makan kacama, that's why I full pad sok. So our action is monitor. 2 hours or 1 hour later, you have to check mothers again. If mother say, I tukar lagi, pun still full pad sok. No, you don't wait. You can tell your manager or can ask mother, ask husband, bring mother, immediately go hospital for a check. That one is not normal, because usually the blood loss will getting less and it will not getting more. If it's getting more, it means maybe there are some uterine tissue, some tissue inside the uterus belum dibersihkan. Jadi uterus tidak pandai contract, then dia pandai bleed a lot. So these one need treatments that need to go to hospital. Alright. So for blood loss, you have to remember it is getting less, bukan getting more. And it also will not like suddenly today already day 7 sudah kurang, tapi tiba-tiba day 8 dia banyak. Nothing to do with the makanan. If it's makanan, usually it's just that moment. Let's say pernah tengok kah when mother after taking kacama or some herbal soup, after that suddenly bleed a lot, but just for that moment, after that tak ada sudah. Got? I think that is quite normal lah. That is how the herbal lah, kacama did, because it will help to contract your uterus. It will trigger the oxytocin hormone and to pass out the, we call it dirty blood. Yeah. So it will just maybe once, it will not lasting like continuously every 2 hours. Yeah. So this one remember, if anything that you are not sure something is not right, immediately report. Okay. So we have to tell mother, take good care of the lower part also. Say, what is my advice to change the pad? Berapa jam? 4 hours. That is the ideal one. We need mother to change pad every 4 hours to maintain the hygiene. Okay. And usually, lepas beranak, when they come here, especially I think our local people here, they don't dare to touch water. Am I right? And how they cuci the pepet? How they cuci then? Tak ada cuci kan? They will just put on the pad, right? Yes, or they will use wet tissue. But when they will use wet tissue and the hand is still very dirty and your toilet will be blocked and the maintenance will be habis cerita and they will keep complaining already when you call someone to repair for the toilet, right? So we still have to advise mother. I know there is a lot of pangtang lah, regardless of Malay, Iban, Chinese, semua sama. I think in this place in Sarawak I think almost about the same. Tak boleh sentuh air, yeah. But in confinement center here, how you want to advise to mother that they actually pangtang don't want to touch water? Anyone encounter mother like that before? So what is your solution? Pernah? Mommy said, saya tak mau sentuh air. My mom asked me don't touch water. But you come in and say, Mommy, you need to clean after every time pass urine, pass motion, you need to cuci. Mesti perlu cuci because confinement center here, they provide the herbal wash for you already in every toilet. So you need to wash. Tak mau, saya tak boleh sentuh air. So what is your advice? Using glove? Okay, they will use glove. Okay. So that they don't touch the water. But that one's the joke, man. It got warm one. Very good. So they will still wash and you tell them the solution. Use the bidet lah, Okay. Any other methods? Or you have seen mother did that before? God. Only use bidet. And mostly mother now okay already, is it? They can touch water, right? Okay. Have to touch water. Have to wash. Because if you don't clean properly, I tell you that is the worst, I think, unforgettable memory as a nurse in labor room for me. Kalau beranak, I'm happy to see all the beranak keluar, the baby keluar, even sometimes mami tahi pun keluar, berak pun keluar. For me, it's still okay, right? Acceptable. But if a mother tak mau cuci for 1 week, lepas dia after labor, what will happen to her? Infected. Kalau pepet infected and it's got bleeding there, got lochia still, and mother don't want to wash, just dab with the tissue sometimes, and it is infected and got pus. So at the end, sangat sakit, sudah demam, come into the hospital. Once doktor buka, tengok, okay, habis cerita, masuk labor room, we need suture, or we need to do dressing. We need to pack gauze inside. When we heard for the wound repair, aduh, semua punya misi itu mask tak tahu pakai berapa layer, because it's very, very smell. And the doctor comes out, honestly, when the doctor comes out, the doctor say I need to bath a few times. I think the smell is still like a perfume stick on my body, you know, and it's very smelly. Okay, smell is one thing for us, but for mother, it is suffering. And it takes weeks to heal for the wound, because if it's really breakdown wound, doctor only can pack gauze, clean, do I&D, clean it, pack dressing, and you need to come every day to change the dressing. Sampai dia sudah heal, then only you have to suture balik. So it takes 2 weeks at least to heal. Jadi you have to tell mothers, hygiene is more important. Tak boleh sentuh air, pakai glove kah, pakai bidet kah pun boleh. Every time lepas kencing, lepas berak, mesti nak cuci. Yeah, if they complain of pain, have to seek for medical advice, right? Because I don't expect you all know how to inspect the wound, right? If we don't know, we can ask mother to see doctor. Yeah, so it's okay that you don't know how to view. Yeah, tapi we can be rational to hear mother's complaint. Yesterday ada sakit kah? Tak ada. Today ada sakit? Ada. So the pain is worse than yesterday. Means that something is not right. If the pain is getting worse, the score from 0 then suddenly go to 5, the pain score, means something is not right. Kenapa pandai sakit? The pepek can be infected already. It can be swollen up, or it can be bleeding, right? Internal bleeding, bengkak sudah. So all this will cause pain, cause uncomfortable. So have to see doctors, right? Okay. So after talk to about uterus, Pepe, now we see the breast changes. I think breast is more common, and I think most of you have encountered this. Selalu mami cakap breast sakit kan? And I heard the mother's feedback from you all. You all help a lot on the breastfeeding parts. When mother comes to you, because they only see me once, so you are the one who always assist mother, which is very good, right? So for these breast changes, is actually undergo significant changes to prepare and to sustain the breastfeeding. So because of the hormonal changes, it will stimulate the milk production and ejection. Then breast may become larger, firmer, and also be more tender. Saat ini tak perlu saya cakap pun kamu orang tahu kan. Once coming, the next day surely complain of susu bengkak. So when susu bengkak, this is something common, right? But can it be prevented? Can it be prevented so that mother tidak complain susu sakit? Huh? How to prevent? I think there are some mother totally tak ada breast pain punya. What did they do? Latching. That is the paling basic things and paling natural way for mother to do. Baby keluar, lepas lahir, definitely breastfeed. Kalau dia breastfeed on demand, definitely mother will not feel breast pain. But how many of them do that? And I think mostly we also never encounter mother did that, right? We just tell mother, oh kalau bengkak, okay, you pakai inilah, pakai itulah, macam mana massage lah, this and that. Yeah, so here, what you all can help mother is to encourage them breastfeed. Confinement center is not only here. Most of the confinement center, because you are a service line, and most of you want to take care of the baby and make sure mother rests. Am I right? So most of the time, sorry, I think that's my feedback. Mother, when mother asks for baby, nurse also will say, Mami, you rehat lah. Tak apa, baby kami jaga. Mami, breastfeed sudah 1 jam oh. Kasih kami lah, baby kasih kami, you rehat. You are very gentle and very kind to mother. But in the other way, when we take away the baby, then you will see the baby is not breastfeeding on demand. And the next thing mother will cause breast tenderness, right? This is very common because nurse takut kalau baby selalu dekat bilik mami, nanti bos tanya, Ingat kita ini ya, mau curi tulang pula, right? So, but we think in the other way. If the mother wants to breastfeed, we help. If the mother don't want, then of course we take it. So we have to help for those mother who want to breastfeed. Is that okay? Because I think admin also here dengar sudah, so they will understand better why you put the baby in mother's room, right? So you explain to mother. As long as we know what mother wants, then you actually can provide a better care. Okay, all right. When we talk about breastfeeding, that is another big topic. So today we just want to make sure we can manage on the breast tenderness, especially because of the milk kick in, usually day 3 to day 5, right? So frequent breastfeeding or on demand is the first thing we have to encourage mother to. Kalau untuk mami yang tak mau breastfeed, pump or hand express. Yeah, all this hand express or pump, it has to be regular. Satu hari berapa kali? Yes, every 2 to 3 hours. Tell mother there is no way like lazy. Bolehkah saya pump 3 kali saja? Cannot. Kalau dia mau buat 3 kali sehari, means that she will still encounter engorgement. Yeah. For how long? Maybe for 1 week, 2 weeks, then baru dia rasa lega. So why mother want to suffer for the first 2 weeks? Yeah, so you have to be firm and inform mother. Kalau tak mau breastfeed, then you have to regular hand express. Adakah termasuk malam? Yes, including night time. That's what they have to do. Or you can tell them, let's say the breast is really engorged, then we do warm compress. Okay, that way hot compress. Hot compress for how long? 5 to 10 minutes. Good. Only 5 to 10 minutes or 3 to 5 minutes pun sangat-sangat cukup already. It's not the whole day pakai hot water. It's not whole day. I think Kaya are still very good. Like all the nurse won't advise mother to hot compress the whole day. Some, yeah. When I asked, they said the nurse asked me hot water, just compress for whole day. What will happen to the mother? What happened to the breast? Semakin bengkak, semakin bengkak, semakin bengkak. Instead of you want it to reduce, right? Because you keep giving hot water, hot water, hot water, you activate. So the susu semakin banyak. Then it get worse. So hot compress only to do before feeding. Sebelum dia mau feed baby, baru hot compress. Or sebelum dia mau pump, baru hot compress. Other time, let's say, dia sudah pump 1 jam. 2 o'clock, baru dia pump. By 3 o'clock, because belum sampai masa, right? By 3 o'clock, dia rasa sangat sakit. So, what should we encourage mother to do? Cold compress. Yes, use cold compress to reduce the discomfort. Or this mother just finished pumping or just finished feeding, but still engorged. But she want to stop because it's already long, more than 30 minutes. Then that is the time cold compress also. But if cold compress mother said pang tang tak mau sentuh air sejuk, can we replace with? What can we replace with? Can. So replace with what? We don't want to use the ice cube or ice pad. Some mother okay, so they have ice pack themselves. They have the breast pad, right? They put in the fridge. But some mother, they don't want to use sejuk, right? They say contrast for the confinement periods. So we can use one type of vegetable. Apa itu? Kubis. Yeah. So center actually can prepare kubis. You just put in nursery pun boleh. You just, if mother got this engorgement, you just tiak kasih 2 piece timbang sini. Yeah. You make salad to eat. Right. So that is after breastfeed or after pumping. You want to make sure mother feel comfort is cold compress after breastfeeding. Alright. And make sure avoid excessive cleaning, especially nipple and areola. We've seen a lot of mother, especially after COVID, mami selalu wipe, cuci nipple before they want to feed baby, right? Or after baby latching pun dia cuci. Satu hari saya rasa 10 kali, 20 kali dia cuci nipple dia. Ya, before pump cuci, lepas pump cuci. What happen next? Kalau dia selalu cuci. Crack. Bleeding. There's one mother come and ask me, just text me one problems. Easily crack, want to consult me. Ayo, I should ask her to come. So that's why I boleh untung tu ya. But on the phone, I have settled her problems. Because she always do excessive cleaning. And the problem settled. Means that my advice to her is, jangan cuci. You mandi saja cuci. You no need to cuci every time. Kenapa? Yeah, our breast, we have nipple and we have areola, right? Right. Now, areola side, that areola ada, this areola, this side, ada sebum, ada ointment. Pandai berminyak-minyak sikit kan? So every time we change bra also we know. Selalu mak cuci is the middle one, right? Because got stain. Then what is minyak? What is the minyak for? It's the protection. It protect your nipple. Other than protection, apa lagi? We call it mother smell. Bau mami. That's the natural things that when baby come to mommy, dia sendiri cari kan? Because baby can smell susu. Yeah, so kalau mommy keep wipe away, then you will see the baby tak dapat cari lah. Then we have to guide the baby. So don't wipe. The sebum, it can help to protect nipple. Secondly, it can provide mother's smell. Thirdly, it also antibacterial. Yeah, so don't wipe away. It actually helps a lot. So we tell mother just gently clean enough. Mandi clean. Unless mother baru habis makan this chicken ginger with a lot of wine, then sweat a lot, and then sangat masin lah. They want to wipe okay, but not always. Kalau selalu cuci, sebelum baby come cuci, lepas baby feed also cuci, then you will see the problem comes in with cracked nipple. So now you pun pandai sudah avoid all this cleaning, this cracked nipple. You can help mother on the cracked nipple, right? So kalau betul-betul crack, what should you do? Or what is your advice to mother? You think, oh, sudah merah loh. How? What to apply? Susu. Susu apa? Yes, susu sendiri. That's the best. Better than the nipple cream. Yeah. You always see I bring a basket in, right? Inside my basket, ada nipple cream one. Right? I will use a different size lah, right? Some lecithins. I bring all this, but no nipple cream because the best nipple cream is your breast milk. And how to prevent it crack. Of course, there is other way of crack is because baby tidak betul feeding. Jadi, baby only hisap dekat nenen puting saja. Jadi, dia crack. So, we have to teach mother the proper way how breastfeed and also how to take good care of the nipple. Then, there is no cracked nipple, no nipple sore. Yeah. So, now you have another skills. When mother tell you, Missy, tolong tengok. Okay. Crack already. Then you have to find out why crack. So, the common problem is because feeding tak betul or mother keep cleaning. Then you can give your advice already. Boleh ingat? Yeah, you can write it down if you want. Okay. Because all these are the tiny things that mother may encounter. It's not a big issue like heavy bleeding. No. Sometimes mother really tells you, I got cracked nipple lah, I got headache lah, this and that. Very, very tiny things. So, when we want to do it, it's not like, saya pun tak faham oh. Nanti you kasih Kylie ya. Kasih tahu Kylie ya. Ayu kasih tahu Naomi ya. Ayu kasih tahu mereka lah. Saya tidak pandai. Like that. Then what is the image? Even you are just caretaker as a nursery staff. But if your answer is, saya pun tak faham oh. Then next thing mother might thinking of this kind. Adakah mereka send the nurse pergi training Right? So what is the proper way of answering mother? Even you lupa oh. Baru saya belajar yesterday from Madam C. Tapi saya betul-betul lupa. Because you are only in this confinement maybe just 3 months. Tadi siapa 3 months only ya? Yeah? You never encounter mother. So you are a bit scared, not confident. So what is the proper way to answer mother? What do you think? The best way for you to answer? Let's say mother asks you, I got cracked nipple, but you've forgotten what you have learned today. What is the best answer for mother? And you also think, what is the best answer? Kalau mother tanya you sesuatu that you tak faham, you pun tak tahu. Firstly, we don't give the answer, right? Firstly, you ask question. That's the technique of how we handle mothers. Even you tak tahu, you jangan show, saya tak tahu, oh mami sorry saya baru di sini 3 bulan. Then they might think, Kylie, I want to call you. Come, personal talk. I don't want this nurse to nurse my baby because she only worked 3 months here. Adakah? Some fussy mother, they really reject if you have no experience. Jadi, no need to tell people how long you work here. You ask questions. They ask you, crack nipple. Then you ask further questions. Berapa lama sudah crack? You know the WWW, 5 wife and 1 husband, remember? Macam mana ni boleh berlaku? Mami you sejak bila? Berapa sakit? Ya, baby macam mana feeding? You ask a lot of questions. Lepas tanya question, mami already inform you this and that, inform you this and that. Say, I think this thing, I have to ask manager to come and have a look. I think this is also not normal. You can tell her your opinions, but you don't give answer. Saya rasa ini memang because of baby latching salah. You don't give answer because you're not sure, right? So you ask questions. After you ask questions, you get more information. Then you say, okay, macam ini, mami, I think this one need manager to come and have a look. Is it okay? I call Yvette, I call Kylie, come have a look. If you are the mother, satisfied or not? Satisfied or not? You puas hati kah? Because this nurse really concerned on my questions, really concerned on my condition. Yeah. Kalau you tengok mother kasih tahu kamu because of cracked nipple, terus you cakap, ayo saya tak tahu, nanti saya tanya nanti you terus jauhkan diri then mother might think you not even concerned on her feeling, her problems, right? Tapi if someone tell you a problems and you keep asking, ayo, mana sakit sini sakit kah? Ataupun sini sakit, mana sakit? You show your concern and mother will feel better. Rather than, sakit you ada makan ubat lah. Then you walk away. How would the mother feel? Yeah, so when someone tell you the questions, what you need to do? Ask questions. It show your concern. Walaupun you takut lah. Or maybe this is a very VVIP the head of the hospital one pengarah apa. Sometimes because Kyle very 5-star, sometimes you might meet someone is a singer kah, very famous person kah. You takut, jangan takut. Keep on asking question. Yeah, you don't need to takut. Okay nanti saya suruh the senior come. Then they know you are not senior. Betul tak? Then they might think, this is junior. I better don't want this person to assist my baby. I don't want. They reject you. Siapa punya masalah? Is it the management go and tell mother because this is junior? Tidak. You sendiri yang pecah rahsia. Right? So you show your concern. Okay. Next. So far okay? Boleh ikut? Any questions so far? Before we go? Alright. Okay. So, breastfeeding, okay? Next one. Now, when we come to this hormone adjustment, this is the one always cause mommy go crazy one. Because of all the hormones during pregnancy, semua naik. Estrogen naik, progesterone naik, whatever hormone naik, right? So, becomes like mother upside down, right? Then, after beranak, lepas beranak, semua ini hormon suddenly turun. Right? All the estrogen, progesterone, semua drop dramatically after delivered. Then, it will really affect the mood and also physical recovery. Selalu, it takes about 2 weeks. Yeah, you will see mother sangat emotion. Ada? Do you know how mother feel? Yeah, imagine on the time before you have your periods. Pernah ada orang cakap kan premenstrual syndrome. Jadi what is your PMS? What is your problems before period datang? How you feel? Rasa mau marah orang kan. Setiap hari tengok Kylie happy tapi hari ini saya tengok dia, saya rasa saya mau marah dia saja. God, every day you are okay with chicken rice, but today you see chicken rice, you rasa memang no appetite. But you crave for chocolate lah, ice cream lah. Yeah. Pernah? Oh, you just sitting there. Ayo, husband come back pun rasa, penat tengok muka dia. Kenapa saya suka dia? Ever? Yeah. So sometimes these are the emotion that mother feel. Apa dia pandai itu? Okay, kena. So if you have very strong PMS syndrome, then you know better why mother very emotion after beranak. Because your premenstrual syndrome take for how long? Berapa hari? Selalunya? 1 week Ada begitu lama? Yes, about 2-3 days These 2-3 days you pun rasa sedikit kisiau sudah. Right? Kenapa saya suka sikit-sikit sudah menangis. Sikit-sikit rasa mau marah orang. Ada? Yeah, but we know how to control ourselves. We know that almost, because you will feel a little bit discomfort already. You know soon your period is coming. Yeah. Maybe some youngster, you don't have these PMS problems. I mean, that is good. You don't ask for it. Right? But some of us, some women will feel it. But for mother, this kind of emotion, it takes how long? Tiap-tiap hari tak selesa. Rasa mau marah orang, rasa mau sedih saja, mau nangis saja. Makan ini tak betul, makan itu tak betul. Kayak already serve so premium food, pun dia rasa tak ada rasa. It's not because of your food. It takes how long for mother to experience it? So for normal woman before period, it takes us about 2-3 days, right? But for postnatal mother, it takes about 2 weeks. That's why I always inform staff, the first 2 weeks, whatever mommy complain, you try to fulfill what she wants, but don't take it too much. Pernah, mommy tengok you pun dia terus terang. I think you tak tahu macam mana jaga my baby. You better don't touch my baby. Then you might feel, ayo, sedihnya. Maybe I'm not good in this career. I better change job. Yeah, sometimes we feel very negative, right? But please don't take it, because this mother don't mean it seriously, right? For the first 2 weeks, they might just hentam everything. Hentam on their own husband or hentam you. They will hentam their mother-in-law or hentam you. Usually they can't express too much or marah. Even they tengok the mother comes, mother say, don't touch water, don't touch this one. Mother-in-law also come. Hey, you better don't eat this one, don't eat that one. So for mother, can they scold their own relative, their own parents? Usually they are not. I say, okay lah. Tapi inside her heart is so sedih already. And when the husband come also, you better listen to your mother. Your mother asks you don't eat this one, that one. So she might feel that nobody understand me. Hello, I'm staying in confinement center now. Someone is giving me food. Someone is taking care good of me. But sekarang my problem is sakit sini. Do you ever understand or not? Me sakit sini. You keep asking me, don't eat this one, don't eat that one. And then why baby jaundice? And asking me, ya lah, I tell you don't eat papaya during pregnant. And now baby jaundice. Mami kena marah. Betul tak? Kena blame. What have you done during your pregnancy? Already asked you, don't eat this one, don't eat that one. Now baby jaundice. Mami yang kena marah. Pernah tengok mami like that? Or you yourself, have you ever encountered this? When you're pregnant, when you're postnatal? Yes, sedih. You rasa, itu papaya is not an issue. I'm a nurse, I understand. But your family member don't understand. So you feel very sad, right? So this kind of emotion, when they jumpa you, and you are the one tidak wrap baby properly, only tidak wrap baby properly, or you kena marah sudah. Right? So sometimes it's not that mother gila or they're really very bad tempers. There are also a woman who is very gentle woman, gentle lady, they want to treat you all very nice, but somehow because of the emotion, yeah, unfortunately, sometimes they marah the one that they pet lah. It's not only nurse, I think Kylie or Naomi, maybe, we don't know, right? Yeah. So that is how we call hormone changes, especially the first, how many weeks? The first 2 weeks. Yeah. Okay. And you will see the prolactin hormone increase because of to produce milk. Oxytocin also increase. The rest of the hormone reduce. So this oxytocin will cause mother having sakit perut, uterus contraction, and can cause milk ejection. But it is a good bond with baby, because oxytocin, we call it love hormone, right? So how are we going to help mother so that cut short or reduce the stress? How? Do you know why in confinement center usually they serve dessert? Selalu tengok mereka makan kek, sedap kan? Tengok ayu air liu pun meleleh sudah. Not nice or not? See, as a normal woman, usually we are happy with dessert. So the dessert actually can reduce stress. Pandai mereka buat kerja, buat business serve mommy nice dessert so that mother reduce the stress. I think mother also ever share with you, all right? Saya tengok that treadmill makan pun bosan sudah, but every time waiting for the dessert. Pernah? Yes, because it make them happy. Even some mother said, I can eat cake ka, I can eat this cake ka, I can eat that cake ka. So you have to pandai-pandai and tell mothers lah, right? Okay. Balanced diet is a must. No matter what race, Malay, Chinese, Iban, whatever race, we will have to be balanced diet. If they say they don't want to eat kacama, then we replace other things. Not necessarily kacama, right? And if they said they don't want to eat veggie, then you have to explain to mother why we need veggie. Kenapa mami perlu balanced diet? Ataupun makan daging saja the first 2 weeks. Pernah mami request like that? No veggie, only meat. Yeah, but I'm sure you all still serve veggie, just that mother tak mau makan lah. Right? Because of the pangdang. So we have to inform them, if mother tak makan veggie, we takut sembelit. Right? So have to eat meat, have to eat veggie, have to eat fruits, have to drink the soups. Make sure dia tidur bagus. When mother see me talk about breastfeeding, I will ask her, you need to rest in between breastfeed. 3 hourly pumping. So that 3 hours, you have 2.5 hours to rest. Please rest. Jangan main handphone and do this and do that. Try to rest as much as possible to get the milk supply. And when mother have enough rest and sleep, then you will see that actually emotional is more stable. Then when we come to emotional support, when you see a mother is so moody, this one have to ask Kylie lah. Some mother, there are 1 or 2 particular mothers. Whatever DIY talk, you suruh dia keluar pun dia tak mau keluar. Do we need to take some action? Usually, what will you do? What will you do? If the mother really reject, this one I don't want, that one I don't want. Okay saja lah. Yeah. There are 2 reasons. One is, this mother doesn't want anyone to know her. Kan? It's memang the personality, maybe it's the social life, she want to be isolated. This one, we accept. But the second one is, it could be emotional. So, when we don't know whether this mother is memang dia mau isolate dia sendiri or because of emotional, our thing is, after you text mother about the DIY class, maybe there's already 2 weeks, mother pun tak pernah join even one. So you can actually visit the mother. Then you always visit, right? So from the visit, you don't need to ask her directly, Mommy, why you don't want to join our DIY class? Very good one. You see, Madam C also come to give you a talk. Very good. Mother just, kan? Tak mau. Right? So visit them is just to give some concern on her. What happened to this mother? You need to go in and understand her better. And if you found out that dia memang because of want to isolate, then okay lah. Because the husband is also around. But when you enter, every day you all visit mother, right? If you enter 10 times, but out of 10, 5, 6 times dia memang menangis kah, this and that kah, right? Even mother is not telling you the problems. You have to suspect she is having depression. Also, 2 types of mother. Tak mau join activity, jarang ada. But kalau ada, you have to find out which one. Kalau it's because of want to isolate themselves, that's okay lah. But if it is a second one, you will be the first person to find out the depression. Right? So, next, of course, we talk to manager or talk to the husband already. Ya, banyak kerja nak buat no. It's not the so tak mau lah. But sometimes if you are interested into this job, actually we are all women, right? Yeah, semua women ah. So we actually understand women better. Just that sometimes we scared. Ayah, I better don't kacau lah. So it's no complaint, bagus sudah kan. Sebab put your hearts into mothers and give more observations and you will notice more on what mother actually wants. Alright. Okay. Now, not only the uterus, breast, sometimes the wound pain. Now we come to the wound pain. Now, lepas beranak, perineum is the private part area. Lepas beranak, usually perineum will cause a tear because doctor will cut, right? Cut at the perineum parts, right? We call it episiotomy. Then mother, kalau normal delivery, usually mother will have this bruising from the vagina. And usually mother will ask you a question. Hey, nurse saya rasa macam ada hemorrhoid oh. Pernah? Tapi sebenarnya bukan hemorrhoid. It's because of bengkak. Yeah. So you have to tell mothers if it's less than yesterday, sebab yesterday beranak. Hari ini come to your center. If the pain is less, then it's normal. If the pain is getting worse, again, the bengkak could be internal bleeding also or some other issues. Jadi kalau the bengkak is getting less, that is normal. If you are not sure, I think you have the head nurse, right? Ask the head nurse to do do a perineum examination to see whether the wound is okay or it's not okay because it's really awkward feeling, right? Rasa macam betul-betul ada hemorrhoid, but actually it's not hemorrhoid, it's only bengkak, right? So what we have to help mother, sama, pad change every 4 hours and clean with water after passing urine or stool. Can take painkiller. Usually lepas beranak, kalau doktor ada kasih painkiller to mother, it is always can breastfeed. Mother's concern usually lah. Dia tanya kamu, ini ubat boleh makan kah? Then you ask her one question. Ini ubat dari mana? You beli sendiri or doktor dari hospital kasih? Or you can see the packing It's memang from Borneo Medical Center or from KPJ, you know it's postnatal and you see the tarik. But if you see only one strip, dia cuma kasih you like that. Ini boleh makan tak? Then you have to ask her, ini ubat dari mana? Oh, beli sendiri. Then better consult doctor. Even you don't know what medication is that. Right? So if it's from doctor, no problems. But if it's buy sendiri or from friends or from a relative, then better have to ask doctor. Okay. Jangan Google search sendiri Is this Voltaren suitable for breastfeeding or not? Don't Google search because Google's information is not 100% correct one, right? Especially medications. Okay. So far, okay? Good. What about cesarean section? Selalunya cesarean section apa masalahnya? Susah nak bangun kan? Mau pusing pun susah. And for some mother, they can do it themselves. Some mother, they got husband besides her. But some mother really sakit, until they need your help. Do you know how to angkat mommy up from the bed? Yes, means you pernah angkat mommy Kesiannya. Today, I give you a good news. No need to angkat mommy. Yeah, in labor ward, postnatal ward, I never angkat mommy unless this mother really low blood pressure lah, this and that lah, got some special condition. If this is a normal mother, just go for cesarean section, blood pressure, vital signs semua normal, saya suruh dia bangun sendiri. Now you need to teach mother bangun sendiri, bukan suruh you tak mau tanggung jawab help mother, it's not caring, no. But when you help her, she will always call you. Missy, come in. I want to get out. I want to go to the toilet. Please come in. Then you'll be very busy. You nak jaga baby. You nak jaga mommy lagi. For first day, if let's say this mother really, because of low blood, sometimes they will tell you the history, right? Because of staying in ICU for 1 week, then baru masuk KR, then of course that one we have to give more care. But for a normal mother, just delivered yesterday and today check out from hospital, coming to your side, cesarean section memang sakit, tapi mother definitely can sit up themselves. Now, I'll show this video to you so that you pandai teach mother how to sit up by themselves. How many of you scissor before? Sakit tak? Sakit. Macam mana you bangun dari katil? So people help you, right? You tak tahu sebenarnya sendiri boleh bangun kan? Nah, now you have to teach mother so that mother will do some movement. Is good for mother. The circulation. Actually, lepas cesarean section, kenapa mereka nak suntik itu is to make sure there is no blood clot. But previously tak ada jarum ini. Previously only for those mother who is really 100 kg one. Yeah, but now they found out if can every mother receive the injection is to avoid blood clot. Kenapa pandai ada blood clot? Because mother tidak gerak. Oh, just baring saja. Mau bangun pun suruh orang bangunkan dia. Yeah, so if mother do herself and she can do it, it actually help for the fast healing. Right? So, how to help mother? Jangan you tengok sajalah mother. Madam Sim cakap you boleh bangun sendiri bangun sendiri Ini bagus untuk kamu Oh no, you have to teach. Say, mommy, you can. You can do it yourself. Come, I guide you. Pakai mulut saja. Alright? Okay, how to bangun? Offline meh? Tak ada leh. Hotspot still running on. Okay. Sekejap I open this one. Okay. Betul-betul tak ada line. Connected? 奇怪，怎么有了。OK， 可以了。So today you learn this, then you can get mother better. Tak ada bunyi Alright, tak ada bunyi tak apa. We just see how to get up. Mother can do herself and without any strong pain. So firstly, kaki bengkok. Lepas kaki bengkok, you will see the hand try to help shift the batok to tepi sikit so that you have more place to pusing sendiri. Nah, lepas pusing, you will see the hand, you will see the leg, turunkan kaki dulu. Then, pakai tangan support, bangun sendiri. Nanti balik, you cuba. Right? You can imagine you are having cesarean sections. So now you want to avoid using the tummy muscle. Then you do this You try whether can get up easily or not. Salah pula. We watch again. Yes. Okay, watch again. How to transition to standing from bed. Okay. Bengkok kaki dulu. So, bengkok kaki, surely it will protect the muscle. Then, shift the buttock to tepi dulu. Jangan terus pusing. Shift buttock, then pusing ke tepi. Right? Kalau bangun sekarang memang sakit. But you have to put the leg down to the bedside. Then use the hand, angkat from tepi. Or push at the side. If there is a holder, you can push aside pun boleh. Senang kan? Yeah, no practical lah. Tapi saya mau you bawa as a homework. Balik, you try it. Right? Nanti kalau besok saya datang, saya jumpa kamu, saya tanya. Alright. Okay, a little bit more before we go for a break. Now, what about kencing? Mami banyak kencing kan lepas beranak? Selalunya. Kurang? Banyak. You imagine when during pregnant, Mami bengkak the whole body, right? Tangan pun pandai bengkak, right? These are all the water. So lepas beranak, because of the hormones semua, everything go down. Dia tak perlu air banyak, sudah tidak takung air, sudah so all the air out from the body. So you will see mother frequently needs help to go toilet. Jadi kalau mami every hours nak pergi toilet, you every hour pergi angkat dia. Or ajar dia macam mana angkat sendiri. Yes, or you teach your husband how to assist mother, right? Okay, usually it will increase the urine production, to help the remove excessive fluids masa dia pregnant, right? And the bladder also decrease on the sensitivity. There are some mother lepas beranak is like urine incontinence. Means that tiba-tiba dia kencing atas katil. Right? Uncontrolled. Dia pandai macam baby pula. Dia tak dapat control dia punya urine. And then pandai pee on the bed. Right? So, jangan malukan mami. Ayuh, sudah berapa? Sudah jadi mami masih mau kencing atas katil that is not. It's because the urine, the muscle, the pelvic floor muscle is weak. Sebab yesterday dia kuat kerja. So, jadi hari ini semua the muscle lembek already. Tak mau kerja. Jadi ada urine pun dia tidak, she can't feel it. So there are two ways. One is incontinence. Maksudnya dia kencing pun dia tidak tahu. Another is more difficult. One is langsung itu kencing tak mau keluar. And they need to go hospital to put on the tube first. Tube in and tube out. Then try again. Yeah, these are all because of the muscle. So how should we help mother on this issue? Right? Yes, tell mother it's okay. Pergi kencing saja. Habis itu kencing, habis all the water retention, then you slim back. Yeah, they pun happy. Because they risau. Kenapa I keep go kencing? Something wrong with my muscle kah? Right? So for the muscle part, if mother said, ayo, saya rasa saya tak boleh tahan. Saya batuk, saya hacil pun itu kencing keluar sudah. So that means the pelvic floor muscle is not firm, is not strong enough. So we teach them to do Kegel exercise. How many of you know what is Kegel exercise? Yeah, most of you tak tahu nanti saya ajar. Yeah, yes, you have to learn because we are all women, right? Yeah, and some more for those who ada beranak sudah lagi have to do to prevent a lot of things like uterus. Yeah, without uterus prolapse, itu rahim jatuh keluar. One day when you grow old or 70 years old, right? Okay, so that is what we call pelvic floor muscle weaken. Dekat pelvic sini, you tengok sini ada tulang, right? Ya, all this tulang dia ada satu muscle, satu layer muscle to support your rahim, your bladder. So all this muscle, masa beranak, it can become very stretchy, then it will be like weak. That's why mother pandai tidak dapat kencing ataupun tak dapat tahan kencing, right? So some mother will have backache. Selalu mami backache dia complain because of their Caesar, kena injection, right? Kena spinal ke, kena epidural. But in the real fact, it's not to blame on the epidural. It's actually to blame on the posture or the hormone changes, right? Semasa pregnant, you tengok all the system become very slow. Digestion slow. Selalu mau muntah, right? Because of the intestine. That is because of the muscle. The activeness low. Gusi pun pandai berdarah because the gusi jadi sangat lembut, lembek, right? Apa lagi? Sembelit, tak mau berak because of the usus again, jalan lambat. All this is because of progesterone tinggi. Try to protect your baby so that to slow down the muscle activity. And this also will cause backache because kalau you tidak betul posture, terus sakit. And usually mother pregnant, they tend to, how they work, macam mana mereka jalan? Kan? And you will see that is the posture. So when they posture like that, definitely will cause backache. And they're supposed to support the perut and masih jalan lurus. But a lot of mother, including me myself last time, tends to work like that because it's more comfortable. Tapi it really hurt the back. So you have to teach mother kenapa backache. It could be due to the hormone changes. It's not only cesarean mother will encounter that. Normal delivery mother also will encounter that. And it's very discomfort. So when this thing happens, our management to mother is to teach them pelvic floor muscle exercise. Nanti saya ajar kamu semua. Okay, and a good posture, self-care and also rest, right? Good posture and also some exercise. I think here also got some yoga class or this physio class, right? Encourage mother to attend. Tak kisah dia Caesar ke ataupun normal delivery, they need some exercise. They need to do some stretching, okay? Teach them good posture. Kalau mau duduk, jangan duduk sengit. Jangan selalu angkatkan kaki, okay? Makan jangan makan macam ini atau main handphone like that, right? A good posture with a pillow support, that is important already, huh? Okay. Alright. So, when it comes to emotional, we will talk more for the next module too about this issue, huh? Okay. Again, kenapa mami emotional changes? Kenapa? Because of hormone changes, right? Masih ingat PMS? Yeah, your premenstrual syndrome. Ingat, you got this mood swing, right? So you remember that and link it to a postnatal mother, right? So mother might have all these emotional changes because of hormone. Yeah. So they need emotional support from family and also from you. Ya. Jangan tengok itu mami sangat fussy satu orang pun tak berani masuk bilik dia. Actually, those mother who is more fussy, lagi you have to attend her. Yeah, because it can be due to emotional. It may not because of the own personality. Yeah, sometimes they need someone to hear. Telinga buka besar-besar and then you will see they are getting better. Right? Kalau mami sangat very emotional and then mau marah baby, should we bring baby to mother? Or should we avoid bringing baby to mother? If this mother keep crying, should you bring baby selalu masuk bilik dia as a routine or should you avoid bring baby to this mother? Bring baby? You tidak takut dia buang baby ke dalam tingkap ke? Yeah, but you can see the answer here already, right? To bond with baby. Kenapa nak bond with baby? Tapi saya takut pula nanti dia buang baby keluar dari tingkap. Yeah. What happened when they see their own baby? Yes, it will reduce stress walaupun baby nangis. Okay, why? This is naturally when mother seeing baby cute kan, and it will stimulate the oxytocin hormone. Oxytocin hormone is a love hormone. We call it, it will relax the body. It will cause mother to produce more breast milk. It can calm the mother. Right? Jadi untuk mami yang more sensitive, more emotional, you takut baby masuk bilik nanti dia buang keluar dari tingkap then you don't go away. You bring baby into the mother, accompany mother, maybe just 10 minutes or 30 minutes, then bring baby away. Or when family member is inside the room, then only you send baby in. Tapi jangan because of mother keep crying, emotional unstable, then we avoid sending baby to mother. Usually tidak lah, nurse tidak, tapi family member will ask. So we have to explain to family member, right? Don't worry. If mommy want to see baby, we will send baby in and we will be inside to reassure the family member. Kalau tidak, then they'll tell you, ayo, my anak perempuan already depression doctor said depression you better don't send baby masuk ke dalam bilik or can we bring baby away back home first Don't allow. You all have to talk to the mother. Don't allow family member bring away the baby because it can worsening the mother's emotion. Because bukan mami tak mau baby is family member terlalu takut risau, mother might hurts the baby. Will mother hurts kalau dia betul-betul depressed? Yes. That's why you heard a lot of like Singapore, in a very stressed country. How many times already we heard mommy and baby? Choo! This year also got one. If you read news, right? So it can be very stressed. So when we know this mother got emotional problems, yes, we have to monitor. When you send baby in, make sure there are some other relative inside. Or you have to accompany mothers. Okay. Family support is very important. So we have to talk to them. If we don't know how to talk, we can always ask them to seek for medical help. Sekarang banyak sudah psychology doctor, have to see doctor, right? Okay, banyak kita cakap sudah. Now you have to do some class activity. Alright, something simple before we go for a short break. Take one paper, everyone, and you write down the mother's problems that we have shared ataupun yang kamu tahu tapi kita tak ada share, then you come to template here. Pass it here. If you think breast engorgement, then you put here. If you think wound pain, then you put here. Alright? So you write, everyone write a problems. Try, you can try to discuss. Yes. Just take 1 minute to write. Don't take too long. Nanti saya tak habis ajar. Yeah. Yes, just one. Even the problems that I didn't teach you, you pun boleh tulis. Macam headache kah, ketiak hitam kah. Now you can write, right? So as long as you know the problems, just use 1 minute to think. That just now saya cakap sakit pinggang kah, sakit kepala, or this one mental problems semua tulis. Then come and template. I give you 1 minute only to think. Just write one condition. Cepat-cepat, you don't need to think so fast. Just one problem, one issue that we share just now. Lepas habis, come and template first. Come. Okay. Okay, representative. Good. You help them pass on. Okay. Anything else? Alright. Any mother worry ketiak hitam? Ada. Alright. Okay. Lagi? No more? Yeah. So you will see what is this. What is melasma? Oh, other pigmentation. Okay, you see got pigmentations. Yes, all the pigmentation also worried the mothers. Breast engorged. Mother don't want to pump or latch. Breast engorged. Milk not enough. Yeah, breast engorged. Back pain, contractions, wound side pain, right? Wound pain. Okay, perineum pain, perut sakit, right? So now, actually there are more, right? Just that repeated. You see, there's a lot of problems for mother lepas beranak. You got these hormonal changes, emotional changes, breast changes, posture, backache, uterus cramp, bladder periods pelvic floor muscle weaken kencing Now, the first 2 weeks, these are most of the mother will encounter. Now, you put all these problems into you now. Imagine, now you have susu sakit, sakit kepala, risau baby jaundice. Put the muscle pain on you now, backache, depan sakit, period. You have to change every 4 hours. Kencing selalu full bladder, right? And apa lagi, right? So this is what happened to you now. You are now day 4 postnatal. Okay, and one day Kylie come in, Mommy, come join us for DIY class. Sangat baik mana. Come mana, come. You mau pergi ke tidak? You tak mau pergi, kenapa? Yes, a lot of pain. Now, another case. A mother come in. A nurse come in. Mommy, now you kasih tahu dia, they told you, you are the mothers. So the nurse told you, Mommy, itu baby dia tak mau feeding dia tak mau kita, selalu nangis. Boleh you come in and you carry the baby, right? Or a nurse ask you to do some things. Mommy, you punya buku di mana? Kami nak buat record. Right? But you are having all these problems. Will you feel irritating? Will you feel irritating? Rasa kacau saja ini Missy. Right? Or while you are having all this pain, you go to the nursery, you mau cari anak kamu. Tapi anak kamu tengah nangis. Even the nurse know what to do. The nurse tahu. Because the baby sudah mau menenen. Got one nurse already prepared. But when you are having all this pain and you see your baby is crying, what is your first action? Geram betul. I spent 10K here. This is how you all take care of my baby. Betul tak? So sometimes we just want to put ourselves into mother's shoes. Sometimes when they see things very tiny and they complain. So when they complain, what we want to do is, just now we see normal problems only, right? We see normal problems sudah banyak kan? Okay, now we come for common postnatal issue. There is actually a lot, but I only point out some common postnatal issue. In your notes, there are actually more, right? But we only discuss some common that you will see, and usually it will happen to postnatal mother. Okay, so postnatal period is a critical time for both mother and also babies, right? So sometimes they experience common problems like what we have mentioned just now, but some they have further issues, right? So today we will learn how to understand and also how to help as a caretaker, right? Do you do observation for mothers? You do by the signs, right? Every day or sometimes once a week. These are all the routines that you will do, right? Kenapa kita buat by the sign? check everyday check blood pressure pun sama saja 120/80. Check pun 110/70. Tak ada masalah pun mau check pulse lah, check SpO2 lah, kenapa nak check? Just because you want to record only? Sebenarnya malas mau check lah, malam ini baru check lah, check pun normal saja. Pernah you fikir like that? Or do you continue check saja because this is your routine? And do you observe so far? Some of you already kerja 3 tahun, some only 3 months, right? So along your working period's time, do you encounter some observation is abnormal? Maksudnya terlalu tinggi ataupun terlalu rendah. Pernah?
Yes.
Yes. So what is your action?
Monitor.
Continue monitor or inform, right? Inform manager. Oh, this one blood pressure, tinggi nak monitor. Ada makan ubat ada, tapi masih tinggi. We observe, right? So by the side for postnatal mother is important because sometimes it can help us to trace out this condition, right? So today we'll point out 6 problems to discuss. Right. First one, PBH. Pernah dengar apa yang PBH? Selalu doktor sebut PBH or this mother lepas beranak dia PBH or PBH means postpartum hemorrhage. Maksudnya lepas beranak dia berdarah. Berdarah biasa itu not PBH kan. Kalau berdarah more than 500 ml, it means PBH. Then PBH got 2 categories, primary and also secondary. Primary PBH is a loss of 500 ml. Usually it happens in labor room. Bukan sini lah. Masa-masa dekat hospital and excessive blood loss within 24 hours, we call it primary PBH. Secondary PBH, any vaginal bleeding that occur between 24 hours after placenta delivered and during the following 6 weeks. Maksudnya, if mother in hospital everything well and come to confinement center and suddenly mother has excessive bleeding, we call this secondary PPH. How do we know it's PPH? Mother tells you banyak darah kan? Other than banyak darah, there's another sign. Maybe mother is still there too. Banyak is normal for us lah, right? But from the vital signs, if mother bleed a lot, you will see the blood pressure drop. Yes, drop. And the heart rate laju. Sebab dia mau pump lagi banyak darah to the whole body. So when you do vital sign to mother, you notice that selalunya 120/80. Kenapa today is 90/60? Mother still okay masih okay, tapi ada pucat sikit lah muka. Pucat sikit pun normal, right? But you notice that something is not right because of the blood pressure low. And the heart rate usually berapa? Mommy's heart rate. 80. Dia punya heart rate berapa selalunya? You use machine to check, right? The machine show apa? 80, 70, 90. That is normal for mothers ah. Somehow you notice their blood pressure drop and the heart rate is 110. Itu baby punya heart rate kan? Tapi it happens to mother and you know that this is something wrong. Bukan selepas dia bergaduh dengan husband, then dia punya heart rate cepat, bukan. Right? So all this it can show us mother got something wrong. Right? So kenapa PPH? Macam tadi saya cakap, kalau uterus keluar, the normal uterus it should be keras or lembek? It should be keras. Tapi kalau dia tidak keras, maksudnya the uterus is no muscle. Atonic means very lembek. Failure for the uterus to contract. Then it can cause more bleeding. Right? Sometimes dia tidak mau contract is because still got some placenta fragment. Maksudnya mungkin ada satu serpihan masih dalam uterus, right? Ataupun trauma or tercedera when masa baby keluar, okay? Or because of blood clotting factor, can be because of mother's blood issues lah. So all this can cause uterus tidak mau contract and it can cause bleed a lot. Right? So this PPH usually it happens, and for me myself in confinement center, during confinement center we have seen
mother PBH in confinement center? Any of you experienced that during your confinement center career? Tak pernah, bersyukur. Jangan ada. Ya. Pernah? Mother bleed a lot and then you immediately send to hospital. What? Yeah. Yes, sometimes as I said, bukannya dia turun ke sana, but you can see that dia berdarah banyak. The first action is not we treat her or you like midwife, we know how to massage the uterus. No, you don't do that because you don't know how to do. What we can do is immediately ask mother, go to hospital. If the husband is not around, drive also you have to ask immediate send mommy to hospital. Or call ambulance. Let's say you're on night shift and none of you drive. And the husband is also not around. So what should you do? Call ambulance. Ada ambulance phone number dekat nursery kan? Call saja. Okay? Immediately come and pick mother to hospital. Right? So usually the sign is heavy bleeding. Tengok blood pressure penting kan tidak? Penting. Oh, you nak check oh. And the heart rate is increased and you will see kalau this one is not monitored and keep bleeding, nextly mommy sawan sudah. Yeah. So it can be a small matter. Tapi if we don't do anything, we just keep monitor, mommy saya rasa biasa lah. Tidurlah, jangan fikir banyak. Habis cerita. Oh, so sometimes when we see something abnormal, you start result, you have to talk to your colleagues already. Tadi saya masuk bilik mami itu, saya rasa dia tak betul lah. So at least you have friends together. Even 3 of you, mungkin you are less than 1 year in confinement center, but you still have friends. Discuss. Kalau not sure, immediately call your manager or your team leader. Yeah, we don't wait. So mother will ask you. Sometimes mother really don't know what to do. Should they go to hospital? They ask you pula. If they are not in confinement center, I think they cepat sudah pergi hospital kan. But because got you. So they usually will ask nurse first, what should I do? Yeah. So what should you do? If mother asks you, blood pressure drop, heart rate fast, and then bleed, what should you do? Yes, immediately go to hospital. Waktu malam pun pergi hospital, got emergency 24 hours kan? Yes. Right. So we need immediate medical intervention. And of course, when they go to hospital, the nurse will do uterine massage. Yeah, and they will try to give medication to contract the uterus. If really lost a lot of blood, they need blood transfusion immediately. So PBH is actually considered emergency situations. And for all the caretaker here, you need to know what is PBH, right? Just in case, because this thing commonly will happen. Yeah, so yeah, you see, kind of buka sampai hari ini pernah encounter. I think other confinement center also, because this is something very common happens. Yeah, so you need to know what to do. Don't wait immediately. Dia cakap jangan tunggu husband balik dari kerja pukul 5. Now it's only 12 o'clock. Can wait or not? No. Cannot wait already. So you have to be firm and tell mother. Right. Next, headache. Is headache normal for mother during confinement? No. Shouldn't have lah. Tapi selalu happen kan? Selalu kita dengar mami headache. And usually headache due to apa? Tidak cukup rest. Cukup rehat. And sometimes they complain because drink too much of red dates, or because of your food terlalu banyak ginger and cause them headache. Yeah. So this can be one of the reasons because they don't drink too much water and they take too much ginger, too heaty. Yes, this can be one of it. And the general headache sometimes it can be due to because too tired, lack of sleep, hot environment. I think here at least okay. Some confinement at home, kipas pun tak mau buka, aircon pun tak mau buka. Oh, kurung sendiri dalam bilik tak boleh kena angin, takut masuk angin nak. They want really kesian, you know. Yeah, this will cause headache also. Okay. Oh, they don't drink enough because someone told her jangan minum banyak. Okay, shopping. Kau beli apa? Promotion. Camping ah, nanti baru shopping ya. Okay. Now, they worry because tak boleh minum banyak. Mami suruh saya jangan minum. Suruh saya jangan minum air kosong. Plain water cannot drink. So vegetable cannot eat. Fruits, ayo, you see kind of some apple apple cannot eat oh. Ini tak boleh, itu tak boleh. Then she don't get enough rest. Sini stress and stress. So at the end, headache. So headache, it can be very general. It's not only because of the food, not only because of the red tag. Yeah. So shouldn't have lah. But sometimes it happens, and sometimes this headache, yeah, this headache can be treated with some painkiller. Yang paling senang selalu cakap Panadol lah kan. Yeah, Panadol or some ibuprofen. Yeah, these are the medication that mother sendiri ada. You don't give your medication to mother. Saya ada Panadol, saya kasih you lah. No, mother usually have their own painkiller lah, right? So ensure mother drink sufficient fluid. Encourage her to drink. I'm not sure whether now masih ada mami tak mau minum dah. Kok ada mami masih tak mau minum dah? So far they okay to drink, right? Yeah, already changed. Last time banyak mami takut nak minum, right? So encourage them to drink more, right? And can get some fresh air outside instead of always stay inside the room. Some mami tak mau kena angin kan? Always inside the bilik, tak mau keluar. Yeah, so you have to encourage them come out, go to outside nursery, tengok baby, and go for DIY class, right? Join others, then get some fresh air. It will reduce the headache. But headache, it can be very abnormal. It can be due to epidural anesthesia. Masa dia bersalin, doktor kasih ubat through epidural dari belakang sini, sama agak sama dengan spinal punya. So sometimes ini jarum masuk, masa jarum keluar, sometimes it can cause leaking. Oh, sebab ada satu lubang sudah. Jadi the kepala ada CSF fluid, ada air. Yang air itu yang buat circulation baik punya, tapi itu air semua dari lubang ini leak out to the body. Jadi CSF fluid ini kena leak out, mother will feel headache and it's very very pain. So we call this epidural anesthesia. And mother might pain sampai dia rasa not comfortable. Dia kasih tahu kamu, saya rasa sini sangat keras, saya rasa nak muntah, saya rasa tak selesa, right? And sometimes they can't really see, you know? So all this is not only headache, but it can be stiffness and it can be feel like want to vomit. Then you have to suspect it's because of epidural headache, huh? This one is due to the anesthesia. Then, again, simple action. Suruh dia pergi mana? Pergi hospital. Jangan pergi klinik sudah. Directly pergi hospital. Then she may admit for some treatments. Okay, right. Headache. The mother tell you headache pun boleh because of high blood pressure. Jadi for the person, for the staff who always do vital sign, you bukan buat then you keluar. You kena tanya mami also, right? And you always ask mami berapa kali sudah you tukar pad. Ask mami everything okay, sebab ada apa-apa tidak selesa, ada sakit lagi. Ask, because by the time when you ask, the blood pressure keluar sudah, oh you 200 over 110, the blood pressure normal or not? No, sangat tinggi. Kalau blood pressure sangat tinggi, usually mother complain apa? Sakit kepala, pening kepala, right? So all this is also need fast action. Again, suruh mami pergi mana? Hospital. Immediately or tunggu husband datang? Immediately. Unless our husband will come immediately. If not, don't wait until husband lepas kerja, right? Because high blood pressure, it can cause a lot of issue to mother. Also, we don't want that happen. It must be controlled, right? Also can cause bleeding, right? Of course, there are some other headache is due to psychological stress. This one is because of emotional again, right? Because of the hormone. So, mother might feel headache, yeah, due to her worry, risau, anxious, marah, sedih, tired. All these can also cause headache, and we call this psychosocial headache. Next one. So headache what is the management for that? Tadi, if we suspect high blood, when you do blood pressure semua tinggi ataupun rendah, the management is hospital. So something very simple. Go to hospital. Yeah, but if it's due to tiredness, rest. So I think all these is not something too difficult for you, right? Next one is infection. Saya rasa this one very commonly happens in confinement sector. Bukan sebab tempat tidak bersih, but the infection it can be due to post delivery, mother's immune system drop. Jadi mother is very easy to get infection. Kalau susu bengkak 2 hari terus mastitis, ada? Why mastitis? Not breastfeeding well and easily to injured. Kalau cracked nipple senang itu kuman masuk, then it will get bacteria. Or we say mother have UTI. Any of you experience UTI? Tahu UTI? Urinary tract infection. Maksudnya kencing sana sudah ada kuman. Sakit when you want to kencing kan? Or sakit pinggang also. And this thing also easily for mothers to encounter because mereka tidak mau cuci. Then senang kena UTI. Sometimes they cuci pun pandai kena because of the immune system drop again, right? Or sometimes they can get uterus pun, yeah, bacteria, right? So all this infection is commonly happens to mother. Or any other infection you all ever see? Apa itu? Mother pernah masuk hospital ambil antibiotik. Kenapa dia ambil antibiotik? Selalunya yang mother ambil antibiotik, usually what is the problem? Wound infection, ya. Wound tidak jaga baik. It's either wound sini ataupun wound dekat bawah lah. Yes, then they get antibiotic. Anything else? UTI, yes. Then they get blood. So all these are common infections. Then when you notice that mother got infections easily, that is your management come in. You are bukan the management. Your management means when you know this mother happens to be like that, it happens that you are the team leader on that day, you are the one who monitor mother's blood pressure, then you have to give some education. Kalau dia senang dapat UTI, you know, you should encourage her cuci, jangan pakai wet tissue, jangan pakai gloves sudah. Oh, berani cuci, and you tell her the fact. Then you say, oh ini misi betul, ya. Then misi pandai ajar saya, okay? They will listen to you more than your mother, oh. Yeah. Poor hygiene, your pre-existing infection that we have discussed, huh? Right. So selalunya kalau ada infection, you will not run away from fever, sakit, discharge, bau. Jadi fever again when you do observation, you can check on mother's temperature, right? So vital sign sangat penting. So in module 2, a lot related to your vital sign check. So vital sign check sangat penting ya. Saya harap dekat KS ni tak ada orang, tak ada staff, tak ada pergi cek mami dan lepas tulis-tulis saja. Ya saya rasa dia 120/81 lah, tulis sendiri. Saya rasa tak ada buat macam itulah. This is one of the common mistake for nurses to do. It's not only confinement center, dekat hospital pun ada mesti macam ini. Sebab malas. Sebab tengok mak itu patient dapat bangun sendiri, jalan sini sana, then assume the blood pressure is normal. Jangan assume. Once you assume, next moment something happen, you will be questioned. Send to confinement center. Even this is not hospital lah, but we just do our part. Check blood pressure, masuk bilik, I think less than 5 minutes only, right? So we just continue to do that, right? Because it can help us to find out a lot of some problems, some issues, and give immediate reactions. Okay? Kalau mommy come to you and you can smell mommy when you assist her to toilet. Kalau you rasa bau itu something is not normal, sangat bau, like itu fishy smell, then you also have to suspect infected already. Ataupun ditanya dia warna, is it warna merah? Ataupun dia kasih tahu kamu bukan saja warna merah, oh, is also ada hijau-hijau sikit. Then you know. Kalau ada warna lain, maksudnya infection. So when you ask for the pet, you also can ask for the color. Okay. Spider sign very important. Good inspection. If you have a nurse or you have nurse, then you can ask nurse to assess the lochia, what kind of lochia, warna dia, amount dia, right? Yeah. Then you evaluate and you inform the team leader. Then the team leader have to do actions like see mother and encourage mother or advise mother to go hospital now. Jangan tunggu, jangan tunggu awal pagi, nanti pukul 8 baru pergi. Lepas breakfast baru pergi. Jangan tunggu sudah lah. Usually we go immediately. Okay. So, if you want to prevent infection, try to advise mother hand hygiene is very important. Some mother takut nak cuci tangan. Tell her hand hygiene sangat penting. Because when they go in and go out from hospital, they will touch here and there, right? And come back, yes, they don't use water but they use glove. Tapi nanti keluarkan glove, dia pun perlu pakai tangan keluarkan glove kan. So all the germs will still bring back. And they go and peluk the baby. Can you imagine? Then baby will get infection. Siapa susah? Semua susah. It's not only mommy susah, nurse pun susah kan? And they will cure your nursery tidak bersih. Betul tak? Okay, so you have to advise mother, hand hygiene very important. Wound care, macam mana take care of the wound? What is your advice to mother for the season wound? Keep dry. What else? Boleh cuci? Boleh cuci ya. Jangan suruh dia jangan mandi sebab ada wound tak boleh cuci. Can. Doctor also advise them must cuci. Tapi bukan suruh you pakai sabun gosok-gosok lah. Just that you mandi, you just lap dam itu saja. Mesti mau make it clean. Lepas mandi, make it dry. Yes, that will do. Oh, tak perlu cover the plaster up. Now no more plaster up for 1 week, no more. 20 years ago, yes, but now no more exposed wound already, right? Then make sure lepas kencing, lepas berak, cuci again and again. Yeah, so before you have to reassure mother, this is very important. And jangan tengok rehat also very important, no. Mostly mother will want to rest up. But we do have some mother dari first day pun sibuk nak keluar, pergi sini, pergi beli itu, buat ini, buat itu, right? So we have to ask mother to rest. We ever see mothers who always go out because they want to buy this, buy that, and at the end mother actually the baby got infected. I don't know what bacteria tapi baby sakit. Sometimes it's because mother come back without mandi and then peluk baby. The germs will still go to baby, right? So we have to make sure, advise mother to do all this to prevent a lot of infection. It's not only suruh kakak setiap bulan routinely bersihkan tempat ini, dan setiap tahun suruh staff buat itu test lah, flu injection lah. No use. If you don't teach mother how to prevent it, then it can actually cause problems also. It can cause infection not only to mother but also to baby. Okay, so the treatment usually is antibiotic, pain management, hydration, and also nutrition. Ini is a must. Jangan tak minum, jangan tak makan. If mau makan, balance diet. Yeah. So next is come to the emotional. Emotional usually it start with just like postnatal syndrome kan. But for postnatal mother, if it's very light sadness, light very mild angriness, right? Mood swing, we call it postpartum blues. Maksudnya this is very mild case very mild mood disturbance, just like us before periods, right? We call it postpartum blues. Then usually it starts day 2 to day 4 after birth, and it actually will generally resolve within 1 to 2 weeks. And I think most of the mother encounter this, right? This is something normal. Yeah, usually it will resolve 1 to 2 weeks after that, back to normal. And the mood also jadi bagus. But if this postpartum blue you don't take care well, next it will go to depression, right? You will see, usually it's because of normal hormone changes and the stress adjusts because of new baby. So if we don't treat if we are not noticed and this mother is not handling well, you will see next mother might go into postpartum depression. Postnatal blue perlu ubat kah? Tidak perlu ubat. Cuma you cakap bagus-bagus sama dia saja kan? And you give more concern on mother, that's it. Yeah, and the family member support, and usually it will go by itself. But if all the support is gone, husband pun marah, come to confinement center, missy pun marah, yeah, mother-in-law marah, mommy marah, then without a good support, understanding, it will very easily go to depressions. This is a serious mood disorder and dia perlu ubat. This one need treatments already. Without treatments, then mother might have the niat untuk commit suicide. Yeah? So you will see the characterized by persistent sadness, anxiety, and also tired. That's why I said if mother sudah 2-3 minggu tak mau keluar, join the others, you will have to see is the mother okay or not. It's not because postpartum blue, it can go to depressions. Right? So usually again it starts with hormone changes. Then maybe there is a history of depressions. Or mother is stressed, and I think this is usually the most important factor, lack of support, especially family support. So jangan ingat husband itu tak perlu datang. Husband come is a very good support to those mother. Yeah. Okay, so the symptoms is persistently sadness or mood swing, and loss of interest in activity. See, apa-apa kelas pun dia tak mau join sudah, and tak mau tengok baby pun, okay, and changes in appetite, tidur pun tak mau. So the sign is very simple. If the mother okay talking to you, but she start to tell you, saya tengok pun saya tak ada rasa mau makan. First, tak mau makan. Secondly, malam dapat tidur mami? Tak dapat tidur. I tidur only 30 minutes and wake up, and my eyes is so big and round at night. Then you have to suspect this mother has depressions. Yeah, these are very important. You see, appetite or sleep patterns is disturbed. Then we have to keep an eye on this mother. Now we assess them. Do you do evaluation on the psychological? Do you have the chart to know her? Some confinement center they did that now. Yeah, but this one is unless you have some nurse can help to do this, right? We can use the evaluation. If not, we buy our rational. When every time we see mother, then you monitor is the mother okay, appetite good. Kalau you selalu buat report, this mother no appetite, unable to sleep well. Tomorrow also no appetite, complain of the food, this and that. You have to take a look, ask yourself, is this mother normal? If this mother is not normal, you tell to your management. Alright? Then give support. Who to support mommy? It's the family member. You are the second one. But you will be the first one to find out the problems. Then we have to ask family member to support. Your support in family support, mana satu can help better? Family support. Family support. So you have to inform the husband or the family member that your concern is mother keep crying, no appetite. You don't say I suspect your mother got depression terkejut mereka. Yeah. Then I ask who are you? Yeah, just because I enter Madam C, I know. No. Yeah. But we tell her because your your wife tak dapat makan tak mau tidur, at night pun tak dapat tidur. Something is not right. Kita bring her to see doctor. Like that, right? So when we talk to the family member, also jangan sakitkan hati mereka lah. Saya dia ada depression. Terus they reject you, they refuse the real fact. Although you know it could be depression, yeah. But you discuss with the family members and guide them, advise them to bring mommy see doctor. Okay. So for nurses, caretaker, admin also okay. Yeah, you all when you talk to mother, reassurance and empathy. Kalau mami cakap dengan kamu, saya sangat letih, saya tak mau breastfeed sudah. Then what is your answer to mother? Mami mau rehat dulu, very good. What else? Dia cakap saya tak mau breastfeed, sangat susah, setiap 2 jam itu madam sini sudah sini, also suruh saya mesti mau breastfeed baby. Explain, okay, explain. Before explain again, the skill is to ask. When you ask, it show concern, your empathy. Ya, sebab you tahu memang breastfeed very tired, right? That's why you want to explain. Memang like that, mommy. Yeah, but before we said memang like that, then we will ask question. Ask what questions? Let's say mami tanya, aku breastfeed sudah, sangat tired, setiap 2 jam sampai memang tak mampu. Gila sudah. So what is your actions?
Mommy okay, breast mommy okay.
Yeah, mommy okay, not okay, very stressed. What other questions you want to ask? Huh? What other questions? Kylie, what you want to ask mommy? Huh? Mommy said I'm very tired. Think. Give me one answer. Huh?
Kenapa dia sangat tired?
Saya tiap-tiap 2 jam mana dapat?
Ambil 3 jam lah.
Yes. So you ask question, you got the answer. Bukan terus kasih tahu dia. Memang like that, semua mami macam itu. Okay. Then the mother will jeling mata. You don't understand my pain. You don't even understand. You belum beranak kan? You still single right? That's why you tak faham. You know, when mother can't feel your empathy. So one mother to feel the empathy, you ask questions, right? 2 jam sangat susah, mami. Berapa lama you pump setiap 2 jam? I spend 1 hour lah. Oh, then you know. Kenapa 1 jam? Medicine selalu ajar 15 minit, 20 minit. Kenapa you pakai 1 jam? You ask. When mother tells you, then you know better. Then you know the answer. Bukan immediately jump to memang like that lah, breastfeeding memang tired. Oh, habis cerita. I said, memang like that. Tomorrow I go see doctor, I ambil ubat. Tak mau sudah, stress sudah. Because you already confirm the answer, memang susah. Yeah. So after you ask, when you know that mother can't do it 2 hourly, then, mami, you cuba 3 jam lah. 3 jam pun boleh, you see that mother also 3 jam. Then you know how to answer. So before you go to memang like that, ask more questions. Because this memang like that, it doesn't work at all. It will show that you tidak concern. It will show that you tak faham. At the end, mother tengok you pun, I'm okay. Tak mau dia nak cakap sudah. Because she knows that you don't understand her. Right? Okay. Open communication is what I teach you just now. Open questions. Bukan memang macam itu. That one is tutup questions. When you ask, berapa lama you pump? This is open questions. Ya. Bila you pump baru you rasa tidak letih, berapa jam baru you rasa tidak letih? Ya, you ask questions. Pernah breastfeed baby directly? Adakah breastfeed directly lebih senang untuk mami? Kalau breastfeed lebih senang, jangan pump lah, you direct breastfeed loh. You ask question. Ya. Then practical assistant. Mami cakap, saya mau breastfeed tapi saya tidak pandai. This is where you come. Okay, nanti lepas saya feed baby itu I come to teach you mami, or I ask Madam Sim lah, I ask this Madam Lee lah, whoever to teach mami ya. Practical assistant, betul-betul you guide her. right? Yeah, and teach coping strategy. Maksudnya, if mother is really stressed, you offer some advice. Mother said, I'm very stressed. So what is your advice to mother? I cannot cope already. Satu baby cukup or tak mau, then keep on nangis. Then you know that this one is very stressed, right? Yeah, so how you want to advise mother some coping strategy? Lepas you comfort dia, it's okay, mommy, it's okay. Then you comfort dia, pat, you know, pat. Jangan takut nak sentuh mommy. Sometimes when you come to sentuh mommy, without saying any words, it shows your concern. Memang susah, mommy. Bukan senang. You feel better, even you didn't give any advice. Kan? Your touch is very important. So you can teach her. Mami, you suka itu yoga music kan? You dengar yoga music lah. This one is very general. You can teach whatever you want to teach. Mami, you suka makan coklat kan? You suruh husband beli coklat lah. Boleh makan coklat ni? Boleh. Coklat kan tambah susu. So you say something very happy, then you will see mother. Oh, boleh nanti saya cuba. Right? So these are what we can do to mothers. Supportive care is very important. Rather than keep mother alone inside the room, you know that this mother fussy, you know that this mother don't want to talk to people, and you just ignore her lah, tak kisah lah, dia tak mau cakap lah. Stay here 28 days only, bukan saya mau forever. Take care of this mother. But within these 28 days, there's a lot of things you can do to this mother. And if you did all this, I believe when mother want to leave this center, saya rasa dia nangis sudah. Right? Memang sangat-sangat rindu kamu orang sudah. Right? Okay. Again, this one just now we also discussed because of the urinary and fecal incontinence is because of the pelvic floor muscle, kan? Sedang weakness. Jadi, sometimes dia boleh kencing sendiri. So, kalau weak pelvic floor muscle, ya, because of vaginal delivery, because of episiotomy, ya, because of instrumental, pakai corset, pakai vacuum keluar, dia betul-betul cedera the pelvic floor muscle. Okay. So, when this tercedera, you will see leak out of urine ataupun berak pun tak boleh tahan. Right? They got urgency to urinate and defecate, difficulty to control bowel movement. So, of course they see doctor. Tapi apa yang kita boleh buat is what? What we can do? Teach mother pelvic floor exercise. And another one is to encourage mother to go for physiotherapy. Yeah, they can look for a physio staff to teach them how to do some other exercise. Tapi before search for professional physiotherapists, what we can do is pelvic floor exercise, or we call it Kegel exercise. Yeah, macam mana nak buat Kegel exercise? Now, show you this video. Then you tell me how to do it. No swallow. This is your son. Salah tekan.
How to do pelvic floor exercises.
Okay, let's have a look at it.
The pelvic floor is a group of muscles and ligaments that surround the openings at the bottom of the pelvis.
Pelvic floor muscle.
If your pelvic floor muscles aren't working well, then you may have leakage from your bladder or bowel or find it hard to empty them. You may also find that you need to get to the toilet in a hurry or that you constantly need to go to the toilet. pelvic floor exercises help strengthen the muscles around your bladder, bottom, vagina or penis. This can help with bladder control and also help treat pelvic organ prolapse, which is where one or more of the organs in the pelvis slip out of their usual position. Strengthening your pelvic floor muscles can also help increase vaginal sensitivity during sex and can reduce the symptoms of erectile dysfunction. If you're pregnant or planning to get pregnant, pelvic floor exercises can help lower your chance of leaking from your bladder or bowel after having your baby. Anyone can do pelvic floor exercises anywhere, whether sitting or standing. To do pelvic floor exercises, breathe normally and relax. Squeeze the muscles around and in between your back passage and bladder. Lift up as if stopping yourself from passing wind and peeing at the same time. Count to a couple of seconds and then relax. Make sure not to do pelvic floor exercises whilst you're peeing, as this could be harmful to your bladder. Do not hold your breath or tighten your stomach or thigh muscles when you're doing the exercises. When you get used to doing the short squeezes, you can try longer holds as well. To strengthen your pelvic floor muscles, you need to have a routine that mixes slow and fast squeezes. Aim to gradually increase the length of the squeeze holds to 10 seconds, repeating this 10 times, in addition to doing 10 fast squeezes. You should try and do pelvic floor exercises at least 3 times a day. Every week you can add more squeezes, but always have a rest in between each squeeze. You should start to notice improvement in your pelvic floor function after a few months. Improvements could include having better control of your bladder and bowel. To help maintain your pelvic floor strength, just keep on doing your pelvic floor exercises. If you are unable to feel a squeeze, then letting go of the muscles, or if you experience pain while doing these exercises, then see your GP to ask for a referral to see a pelvic health physiotherapist.
Let's go. How to do it? Can you do it when you are sitting? Can you understand the video just now? You see the muscle squeeze? Macam mana you nak squeeze that muscle? Macam you nak tahan kencing. I said now, medicine keep on talking. No rest in between. Buat jam ah. Memang bladder pun sudah full kan. So what you will do usually? You tahan kan. Now I tahan my kencing, you don't know right? Nobody can see you are doing pelvic floor muscle. So tahan kencing. You know what to do? Pandai kan? So tahan kencing for how long? 2 seconds and relax. 2 seconds and relax. 2 seconds and relax. 10 times. Then after that, 1 or 2 weeks later, you can do it 10 seconds. Hold for 10 seconds and release. Then hold for 10 seconds and release. Right? Do it 3 times a day. Boleh faham? Pandai buat? Nanti cuba buat lah. I won't see it lah. Yeah? But you have to learn so that you know how to teach mother. Then you talk to mother, senang mami macam you nak tahan kencing. Buat saat. Then release. Then tahan lagi buat saat. You duduk pun boleh buat. You baring pun boleh buat. You berdiri pun boleh buat. And this will strengthen the muscle, can help to avoid leakage. Kalau tidak, some of the mother after beranak will tell you, I cough also will leak out. Cannot, every time I have to put on the pad. Right? Because when I hachi or when I laugh too loud, also will leakage. Right? So, after we do pelvic floor exercise, can prevent all these problems. So this is what you can teach. Okay. Diet also very important. Okay. Oops. Habis sudah. Last one. Yeah, betul. Okay. Diet and this rest again is very important. So After today's class, do you find that your monitor by the side very important?
Yes.
Your visit to mother, is it very important?
Yes.
Ya, bukan saja tengok baby. Send baby into nursery into mother's room dan cepat keluar sudah. Mau sembang dengan mami. Ya, maybe because you all have Kylie lah, Naomi lah, always talk to mother. If you can, just ask mommy, how are you today? Ya, dia tengok you senyum pun dia happy. Walaupun you pakai mask dan tak nampak gigi kamu, but from your expression, yeah, mother will feel very happy. You don't need to talk a lot. The most important thing is let mother talk. Betul tak? Yeah, you don't need to talk a lot. Just be a good listener, and you will see a lot of things will change. Right? So, any question before we stop?
How about kalau mami mau bagi breastfeeding, dia punya nipple inverted?
Inverted is also can be breastfed because baby feeding dekat nipple or dekat areola. Baby feeding dekat areola, dia bukan hisap nipple kan. So tak ada nipple pun boleh. Just that a lot of time we find it a bit difficult, especially the baby sudah pakai bottle. So dia pandai cari tu nipple dulu before dia hisap. Then inverted, usually we have biji aside and create a nipple so that baby can breathe it. Or else you can buy a nipple puller. You know the nipple puller, the biji one. So can ask mother to pull 1 day 3 times or before baby feeding time. Then pull out, then let baby latch. If she find it very difficult, kalau from the first day mother steaming for inverted nipple, no need nipple puller, just put baby here and you will see baby boleh pandai cari sendiri and boleh hisap sendiri. Very amazing one. So if you start introduce bottle, ada susah sikit lah. Yeah, that's why some mother will ask for cup feeding lah. It's because they want to train baby can hisap later. But once baby got the milk bottle, confused already. Then you also can't help mother. The only thing is pump up. Pump saja. Yeah, kalau inverted, it can. You help her cup feeding dulu. I know sometimes cup feeding a bit messy lah, right? But we help mother first. Cup feeding sampai baby dapat hisap. Then we go for bottle. 2 weeks, the first 2 weeks especially lah. After that, dia boleh pakai bottle. Yeah, we let baby expert first into breastfeeding. Yeah, later on if got the techniques, if let's say, if I encounter your mothers here got inverted nipple, maybe I will invite 1 or 2 of you while you are kerja coming to see how we assist mother lah. Yeah, very good questions. I think this is commonly your face. Yeah. Maybe next round we have to learn on breastfeeding course. Okay, right. So, any other questions?
Nokia in C-set and Nokia is
Nokia for cesarean section and normal delivery is supposed to be same lah, sebab semua beranak. But cesarean sections, doctor manually remove banyak sudah. So cesarean section, the Nokia will be less if compared to normal delivery. No matter less pun dia tak akan banyak. It was still like today, it only change 3 pad. Normal delivery mother, it can change more pad. But 3 pad, it will still go 3 pad, 2 pad, 2 pad, 1 pad. It will still going down. It will not like being up. Yes, it will be a bit lesser if compared to normal delivery.
Herbal water can last perfect or not?
Can normal water can?
Herbal water.
Oh, herbal can. Can. I think that is what they do, right? Or they don't dare to do.
They ask.
They ask can. Yeah. But the best is clean water lah. Yeah. As long as they want to clean, rather than they just use tissue to take the tap away. Yeah. Good. Any other questions? Boleh faham? Okay. Senang faham? Yeah. Hopefully my mixed language lah, so that you all can understand better. Okay. Very good.